about KO7 CAR, which require gene editing, and this is only one of our clinical trial for anti-CD7 CAR-T for treatment of T-cell malignancy. So we have another clinical trial, and we develop different approaches. We use different approaches without require any gene editing or any protein blockade. So those are novel approaches to derive naturally selected anti-CD7 CAR-T cell. We call NS7 CAR from patients' bulk T cells. And the CD7 molecule derived from the NS7 CAR was masked or sequestered by the CD7 targeting CAR, so able to avoid a major CAR-T to CAR-T fratricide. And we also put that into our phase 1 clinical trial, and we enrolled total 20 patients. Those results actually already published in recent Blood. And so we put 14 T-LBL patients and 6 patients with T-cell lymphoblastic lymphoma patients. Again, CAR-T cell can either derive from patients' own blood or from their transplant donor. And those are also heavily pretreated patients. The median lines of prior therapy was approximately 4.505. And patient only require one single infusion of CAR-T cells. On the day 28 evaluation, 19 out of 20 patients are able to achieve the deep minimal residual disease negative CR/CRi in their bone marrow or peripheral blood. The 9 patients with extramedullary disease, 5 of them are actually able to achieve the complete remission, and 1 patient had no response. The other 2 patients actually had a partial response and stable disease. So those are initial very good results. Subsequently, 10 CR patients underwent the consolidation allotransplantation. 7 of them still remain in the MRD negative CR with the median follow-up time of 210 days and up to 311 days. And 1 actually died from transplant-related mortality, but that patient had a second transplantation because that patient was relapsed from first transplantation, then received the CAR-T after CR, then underwent the second transplant. So 6 patients without consolidation allotransplantation, 4 of them still remain at CR with a median follow-up, even though still short at the 54 days, but 1 patient up to 180 days still without a clear relapse. And the 2 relapse patients, both those 2 relapse patients have a poor actually STIL-TAL1 fusion gene. Patient with this STIL-TAL1 fusion gene also often represent a poor outcome. Again, here we see patient with this fusion gene had the early relapse. And when relapse, when small CD7 loss was observed. So with the conclusion For those CD7 anti-CD7 NS7 CAR-T cell, also highly effective for treating T-LBL patients, O-LBL patients, even including those patients with extramedullary disease involvement, including those patients who relapsed from their prior allotransplantation. The side effects are, again, manageable. No deaths related to this clinical trial. Certainly, the more patient and the longer observation are required, and we will continue to follow up those patients.